If you're a senior or approaching retirement, you've probably heard about Medicare. But do you truly understand how it works, what it covers, and, just as important, what it doesn't? If you've ever been confused by Medicare's parts, cost, or enrollment rules, you're not alone. In this video, I'm going to break it all down for you, simply, clearly, and in a way that makes sense. Let's get started. First things first, what is Medicare? Medicare is a federal health insurance program primarily for people 65 and older, though it also covers some younger people with disabilities and those with end-stage renal disease or ALS. It was created in 1965 as part of the Social Security Act to ensure seniors had access to affordable health care. But Medicare isn't a one-size-fits-all plan. It's actually made up of different parts, each covering different aspects of health care, and that's where things can get confusing. But don't worry, I'm going to make it simple. Medicare has 4 parts, A, B, C, and D. Each serves a different purpose. Let's break them down one by one. Medicare Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, hospice, and some home health care. For most people, Part A is free because they've paid Medicare taxes for at least 10 years while working. Medicare Part B is medical insurance. It covers doctor visits, outpatient care, preventive services, and medical supplies. Unlike Part A, Part B has a monthly premium, which is based on your income. In 2024, the standard Part B premium is around $174.70 per month, but it could be higher depending on your income level. Medicare Part C, also known as Medicare Advantage, is an alternative way to receive your Medicare benefits. These are private plans that combine Part A, Part B, and often Part D, prescription drug coverage. Many Medicare Advantage plans also offer additional benefits like vision, dental, and wellness programs. However, they usually have network restrictions, meaning you may have to see specific doctors or use certain hospitals. Medicare Part D is prescription drug coverage. This is optional and is provided through private insurance companies approved by Medicare. Part D helps cover the cost of prescription medications and protects you from extremely high drug costs. If you don't sign up for Part D when you're first eligible, you could face a penalty later on. Medigap Supplemental Insurance. Now here's where it gets even more important. Original Medicare, Parts A and B, covers a lot, but it doesn't cover everything. You're still responsible for deductibles, co-payments, and coinsurance. That's where Medigap comes in. Medigap, or Medicare Supplement Insurance, is sold by private companies to help fill in the gaps in Medicare coverage. These plans help pay for out-of-pocket costs like co-pays, coinsurance, and deductibles. However, Medigap only works with Original Medicare, not Medicare Advantage. So if you choose Medicare Advantage, Part C, you cannot get a Medigap plan. Okay, so now you understand what Medicare covers, but how do you enroll? This is where deadlines are crucial. Your initial enrollment period, IEP, is a 7-month window that starts 3 months before you turn 65, includes your birthday month, and lasts for 3 months after. If you enroll during this period, you avoid late penalties. You can sign up for Medicare through the Social Security Administration's website at www.essa.gov/MEDICARE or by calling 1-800-772-1213. You can also visit your local Social Security office. If you're still working at 65 and have employer health coverage, you may be able to delay Part B and Part D without penalty. But once you stop working, you'll have an 8-month special enrollment period to sign up without penalties. If you miss your initial enrollment period and don't have other coverage, you can sign up during the general enrollment period, which runs from January 1st to March 31st each year. However, you may face late penalties and have to wait for coverage to begin in July. There's also the annual open enrollment period from October 15th to December 7th. During this time, you can switch Medicare Advantage or Part D plans. If you're on a Medicare Advantage plan and want to return to Original Medicare, there's also the Medicare Advantage open enrollment period from January 1st to March 31st. To compare and enroll in Medicare plans, visit the official Medicare website at www.medicare.gov. Medicare isn't completely free. While Part A is usually premium-free, Part B has a monthly premium, a yearly deductible, and coinsurance. Medicare Advantage plans may have their own costs, including premiums, copays, and out-of-pocket limits. One key thing to watch out for: late penalties. If you don't enroll in Part B or Part D when you're first eligible and don't have other coverage, you could face lifetime penalties. The Part B penalty increases your monthly premium by 10% for every 12-month period you were eligible but didn't enroll. The Part D penalty is 1% of the national base premium for every month you delayed coverage. These penalties add up, so it's best to enroll on time. A lot of people make costly mistakes with Medicare. Let's go over some of the most common ones so you can avoid them. Mistake number 1: assuming Medicare covers everything. Medicare does not cover dental, vision, or hearing unless you have a Medicare Advantage plan that includes those benefits. Mistake number 2: missing enrollment deadlines. As we discussed, late enrollment penalties can last a lifetime, so mark your calendar and enroll on time. Mistake number 3: not comparing plans annually. Medicare Advantage and Part D plans change yearly, so it's wise to review your coverage every open enrollment period to ensure you're getting the best deal. Mistake number 4: choosing the wrong plan based only on price. The cheapest plan isn't always the best. Check coverage details, network restrictions, and out-of-pocket costs before making a decision. Medicare can seem overwhelming, but I hope this breakdown has made it easier to understand. The key takeaways: know your options, enroll on time, and review your coverage annually. If you found this video helpful, be sure to like and subscribe for more senior health and financial tips. And if you have any questions about Medicare, drop them in the comments. I'd love to help. Thanks for watching, and I'll see you in the next video.